My name is Alicia Hansen. I'm 26 and I just graduated in June from UCLA. How this project got started is I was friends with somebody who had a microcredit project in Uganda, and he saw the pervasiveness that health had. It would put women behind in their work for over a year, and so he wanted to bring nurses out to help improve the health and well-being of the women in the villages and their families. So from there, I went with Nicholas to Uganda. We did an assessment and we went out to different clinics and built partnerships with the local nurses and started collaborating with them and designed programs and outreaches that we wanted to do in different villages, and we would bring a team of nurses out.
So Alicia gathered a team of UCLA nursing students and several other medical and non-medical volunteers. And in December, the team came to Uganda to continue Alicia and her friend's goal of improving the lifestyle and the health of these people. Over the next 3 weeks, the team conducted several medical outreaches to the remote villages who don't have easy access to medical care. So then, Alicia partnered with the faith-based organization Global Support Mission, which is the umbrella organization of the Ugandan-based Bringing Home to the Family, which is an organization created by Faith Kunihira to radically improve the condition of her hometown of Kaihura. She now runs an orphanage, a medical clinic, a vocational school, an elementary school, a farm, and a marketplace. We also worked in partnership with the Sisters of Notre Dame in Busesa. So what we would do is we would pile these bags of mosquito nets on these tiny little motorcycles, or we would all pile in the back of a pickup truck and ride off into these tiny mud huts deep in the hills. And we'd set up mosquito nets and teach the families about sanitation and disease control, primarily malaria prevention, and encourage them to come to our outreaches if they would like to seek medical care. Alicia has taken 3 teams to Uganda, a total of 54 volunteers. In total, we've conducted 2,400 patient consults, 13 village medical outreaches, set up mosquito nets in more than 50 homes, and tested nearly 2,000 Ugandan men and women for HIV. We also donated some medical equipment and supplies to the local clinic in Kaihura.
Liberty, liberty, give our children peace. Why children suffer in this world? When I am walking around Kaihura, and they found a lady begging money, and they asked, oh Uganda, why children suffer in this world? Come on, lead us to the way. Freedom, freedom, give our children freedom, give our children liberty, liberty, give our children peace. Why children suffer in this world?
Hi, my name is Andrea Hansen, and I grew up at St. Matthew Lutheran Church. I'm excited to be in Uganda. This is my second trip here, and I view my role and what I'm able to bring as I support the team. I end up doing a little bit of counseling with the team and processing some of the things that they've observed in Uganda, as well as I'll be doing a skill development workshop with some of the employees at the orphanage.
Well, my name is Linda Hamill, and I'm 55 years old, and I'm a retired nurse. I spent 16 years working in pediatrics and pediatric oncology, and I have just always had a desire to go to a third world country and use my nursing skills to help impoverished people get health care.
Scott Walker was one of the non-medical volunteers, and he and his team of Ugandan workers set out on 2 huge projects at the orphanage in Kaihura, building a bathroom and a kitchen in the younger children's building and installing a ceiling in the older children's building. These projects grew out of serious sanitation and safety needs of both the children at the orphanage and the staff. The orphanage had also seen continuous instances of bedwetting among the children. They figured out that because the latrine was located outside of the building, the children were scared to leave their rooms in the night. Also, because of the lack of sinks, they'd been seeing typhoid outbreaks. Scott and his team were able to finish the projects because we ended up fundraising more money than we had even asked for.
I don't think I came with an expectation of getting anything. I think I had more of an expectation about what I was going to give. And, you know, just I want to help these people, you know, come to an understanding about how to take care of themselves and their health and stay healthy, and so that they can live happy, productive lives and not be so ravaged by AIDS and the diseases that exist here.
Coming here, you learn a lot about your faith, and it continues to grow. You see how people live their faith out who don't have the things readily available like we have, and they're searching for their day-to-day needs, and that just continually reminds me about how lucky I am to live in the States and to have all the things that the Lord has blessed me with.
I keep coming back because I do feel like it's a calling for me. I love practicing nursing and building relationships with people outside the U.S. and having experiences that is nothing like America.
Home again, where